Welcome to this recorded session of Benefits 101. This session offers benefits information for new UW-Madison employees who are eligible for the Wisconsin retirement system. Whether you're university staff, faculty, academic staff, or a limited appointee, this session will assist you with better understanding the new employee benefits being offered to you through your employment here at the UW-Madison. Email my office to request a copy of these slides. By the end of this recording, you'll know how to identify your enrollment deadline, you'll know how to review your plan options, and how to send us your insurance elections and waiver decisions. Today we'll spend time on discussing the Wisconsin retirement system, a good deal on health insurance, and then also the life and disability insurance plans. We'll also briefly review the supplemental plans, such as dental and vision and flexible spending accounts. I work within the Office of Benefits Services, which is a unit within the Office of Human Resources here at the UW-Madison. You can reference my office's resources on our website, hr.wisc.edu/benefits, and you can contact me and my office mates at our email address, benefits@ohr.wisc.edu. You'll also want to get to know your own HR unit, and you can find who they are if you're not certain on our website at hr.wisc.edu/contact. Your HR contacts within your school, college, or division can assist you with different org charts, contact lists, and various unit policies that are specific to your own school. And you would work directly with your division or department HR whenever you have questions about taking leave or your paychecks or even initial benefits questions. Also on our website are summary descriptions of the overall benefit package being offered to you as an employee. If you contact my office directly, please have your employee ID number, also called an EMPL, ready to share with us so that we can find you in our system. Your EMPL ID is a number printed on your paycheck stubs. It is not the same number as is on your WISC card, so you'll want to pull up a paycheck earning statement in order to know what your employee ID number is, or ask your own unit HR office. Newly eligible employees have 30 days from the date they were hired as a WRS employee to consider their benefits options and either enroll in or waive the various options. To determine what your 30-day deadline will be, you'll want to consult your offer letter or talk to your HR unit and ask about your start date. Once you understand what that is, you can literally count 30 days from it on the calendar. On the example given on the screen, you see someone with a start date of February 1st, who then, counting out 30 days on the calendar, means their 30-day deadline is March 3rd. So in order for us to honor your enrollments or waivers, we must receive your choices no later than your 30th day. We're discussing today the various options being offered to you, and before you actually choose to enroll in or officially waive any of these choices, think carefully about what you need for insurance right now and for the rest of this year, but also think about what you might need in the future, because some of these options will be offered kind of regularly to you, and other options may be offered only this once, and you may never have an opportunity to elect them again. Now, the options that will allow you to enroll at any time of year, whether if it's not this month, it could be next month or 2 months from now or 2 years from now, include the UW's Accidental Death and Dismemberment Plan, and also pre-tax parking, the supplemental retirement plans, and the 529 college savings account. Other insurance plans, such as the health insurance, dental, vision, and accident insurances, and the flexible spending accounts, offer usually an annual enrollment opportunity during the annual enrollment fall period for coverage to be effective the next January, or even more often perhaps if you have a significant life event that would allow a mid-year enrollment or change, and such as a marriage or the birth of a child. Now, different life events can affect these different insurance plans in different ways. So please learn more about how life events may affect your benefits by reviewing the details on our website. I also have additional information about the life events for international employees and employees turning 26 that you may be interested in. And if you ask for a copy of the slides I'm sharing today, they will be part of the PDF that we email to you. The two types of insurance that may offer this and only this opportunity for you to enroll are the disability insurance plans, also called our income continuation insurance or ICI, and the life insurance plans. So when I speak about those today, carefully consider not just whether you need them right now, but whether you might need them next year or in a few years, and consider whether or not you want to enroll in them now as a new employee. Once you've had a chance to review all of your options and you're ready to announce your decisions on which plans you're going to elect and which you're going to waive, you'll submit your choices, usually online, or if not online, complete and hand in paper forms. Now, most employees will be able to enroll online. You'll go to the my.wisc.edu website and log into the MyUW portal with your NetID and your password. Find the benefit information tile and click the Enroll Now button. There are other links on that benefit information tile that will take you other places than the enrollment. If you click on the Learn More hyperlink, that will take you to UW Systems website with more information about benefits. And if you click on the Launch Full app, that will take you to a section of the website where you'll see an overview of which plans you've elected compared to which you've waived. Now, as a brand new employee, if you haven't yet elected anything, they would all default to show waived. So that won't be helpful yet, but in the future, that's where you would find your benefit elections versus waivers information. If you don't see the Enroll Now button, that may mean you need to complete and hand in paper applications. And in fact, I know you won't have the Enroll Now button if you have any previous WRS service or if you're moving from the UW's short-term employee grad benefit program to these now longer-term WRS employee benefits. If you have the previous service or you were moving from the grad benefits, you must submit paper applications. If, however, you don't have previous service and you have time to consider your options, you have still more than 1 week before your deadline, reach out to your department HR contact and find out whether your online enrollment button can be fixed. It's ideal to be able to have that fixed and submit your applications online because that will allow us to process your coverage more quickly and you'll receive your ID cards sooner than if you have to wait for our manual paper processing. However, if you're very near to your deadline, I would recommend not delaying, but instead completing and submitting the paper applications. Because whether or not the Enroll Now button is working, we must receive your selections by your 30-day deadline. So don't wait, don't be late. Submit paper applications if the online option isn't working for you. And if you must submit paper applications to enroll in an insurance plan, know that each of the insurance plans has its own application form, and you'll find each in the Forms and Publications section on our website. And today I'll show you kind of an overview of where to find those hyperlinks on our website as we walk through the different types of plans. And if it's the health insurance that you're waiving or opting out, then you would complete the application form, even though you're declining the coverage or opting out of the coverage. We still need to receive the paper application form with your decision. That's also true for the state group life insurance, which we'll talk about today. If you're submitting paper applications and you're waiving that state group life coverage, then there's a section of the paper applications where you'll note that you're declining, and we must receive that from you during your first 30 days. And finally, if you're submitting paper applications and you're being offered the ICI disability insurance, but you don't want to enroll in it, we must receive that application form with you having marked, I do not elect ICI coverage, so that we have official record within your first 30 days that you've decided to waive it, assuming you do waive it. If you're submitting paper applications and waiving other plans like the supplemental dental, life insurance, and vision insurance plans, simply not submitting the applications will by default mean that you've waived. Now, most of you listening to this session will be able to submit your choices online, and within a day or two of you submitting your choices online, you'll receive a confirmation statement loaded into the MyUW portal that shows you an overview of the benefit choices that you sent to us. Please review that confirmation statement and let us know if anything is wrong with it, because if there were, and if you're still within your first 30 days, we could work with you to fix whatever error had occurred. If you must submit paper applications, there won't be a summary detail available as quickly as if you had been able to submit online. It can take as many as 30 days to manually enter the paper application forms from the date you've provided them to us. But eventually you will see the overview of your benefits once they're set up in the system through the View Benefit Summary Detail section. You can also review your benefits by reviewing regularly your earning statements. So those are in the payroll information tile of the MyUW portal, and that's where you'll review your rate of pay and the number of hours for which you were paid, but also how much money has been withheld from your paychecks to pay for the different insurance plans that you've elected, because there is a cost to each of the different insurance options that are offered by the state and the UW. We at the UW-Madison are paid biweekly every other Thursday, 26 times a year. To review the schedule for upcoming pay dates, visit our website to view the pay calendar for the coming year. You'll want to keep track of which pay period you fall into, because most of our insurance premiums are split between the A and the B checks. For example, the January A would have prepaid for the first half of February's coverage, and the January B would have prepaid for the second half of February's coverage. When the Cs come up, there are very few deductions withheld from the Cs, other than taxes and retirement deductions. The insurance premiums for the health and the dental, for example, are not usually withheld from the C paychecks. As a new hire, it can take several paychecks to catch up on the premiums due, since the rest of campus has been prepaying for their premiums from earlier checks. And you're new here, you didn't have an earlier check, so you may have double ups, even triple ups on your initial paychecks received once we have your insurance set up in our system. But eventually, everything will smooth out and you'll begin to see the regular biweekly deductions withheld from your checks. Talk to your department payroll and benefit coordinator if you ever have any questions about your paychecks. And now we'll start today's overview of benefits with the retirement plans themselves. Our retirement programs include the Wisconsin Retirement System and also the UW's 403B and the Wisconsin Deferred Compensation 457B programs. Let's talk first about the Wisconsin Retirement System itself. So this is a pension retirement program which all of us as state employees who qualify for the WRS must participate in. So if you are eligible for the WRS, you do participate in the WRS. And practically speaking, what that means is that a percentage of your paycheck every time you're paid will be withheld pre-tax from the top of your check and sent for investment into the Wisconsin retirement system. Now, the percentage that they need to collect from our checks can change from year to year, but for this year, 2022, the amount that's withheld from our checks is a 6.5% deduction. This pension program is administered by a state agency called the Wisconsin Department of Employee Trust Funds, or ETF for short. And you as a member can reach out to their member services line and can view their website with various calculators and brochures available about the Wisconsin retirement system. The money that goes into the program is being invested by another state entity called SWIB, the State of Wisconsin Investment Board. And you can contact their member services line and view their website for more information on the choices of investments they're making on our behalf. The default investment trust fund into which SWIB will invest your money is called the Core Trust Fund. And it is highly diversified. It is about half stock, but it's also real estate and other cash investments. And the interesting thing to note about the core trust fund is that it has a 5-year smoothing mechanism. That 5-year smoothing mechanism is shown with good example here on the left-hand side of the screen. You see the history of the Wisconsin retirement system from 2020 on back several years. And you also see the effective rate for active employees' accounts in 2020. Active employees earned 10.9% in their accounts because of the investments in 2020. However, the total rate of return for 2020 had been a gain of 15.2. Now, why our accounts didn't earn exactly that 15.2 is because of the 5-year smoothing mechanism that's over the core. Before the system changes the dollars in our active employee accounts, the system looks at that most recent year's rate of return, but then also the 4 years immediately before it. And in a way, it's an average of that 5-year period. To say that is a simplification, but it is, in a way, an average of that 5-year period that then creates the effective rate that changes the dollars in our employee accounts year by year. That did mean that for 2020, while the year itself had been a gain of 15.2, active employees saw 10.9%. The year before that, the gain had been 19.9% gain, and active employees saw 7.7%. The year before that, however, 2018, had been a year of loss for the investments, a negative 3.3, and yet employee accounts still gained 5% that year because, again, using that 5-year smoothing mechanism, the overall history of that 5 years was positive enough to bring up the accounts and still mean 5% growth for each participant. You definitely saw that in 2015, which was another year of loss for the core trust fund and yet still a gain for individual employee accounts. And it was felt in 2008 when you looked back and see the negative 26.2% loss that year still resulted in a 3.3% gain for active employee accounts that year because the years before it, 2007, 2006, etc., had been good positive years. If we go back a slide and take another look at the other trust fund, it's called the variable trust fund. And as I'd mentioned, by default, all of our money in the employer match are going to the core trust fund unless we decide to sign up and participate in the variable trust fund. Now, if we do so, that means investing in stock, mostly domestic stock, as part of this investment strategy. And it would mean dividing how much money we're sending to the core trust fund 50-50 with how much we're sending to the variable trust fund. That is the only division. It's 50-50. And then if you want to be part of the variable trust fund, you would submit an application form to get into the account. And we have a link to the form in our slides and also on our website. You would submit that directly to employee trust funds. And if you're doing so within your initial 30 days, you can be part of the variable trust fund immediately from the start of your employment. If you're submitting that form after your 30-day mark, then they would put you into the variable fund as early as the next January. But if you're part of both the core fund and the variable fund, again, that means a split of your contribution and the employer match, 50-50, one half going into the core, the other half going into the variable. Some participants decide to be part of just the core, the default fund, and thus they always have the 5% smoothing imposed over their investments in the employer match. Other participants decide to be part of the variable, which means they're still always part of the core, but then the other 50% of their investments made paycheck by paycheck are being invested in the variable funds, which does not have a 5-year smoothing. And instead, what happens that year more directly affects the investments. So a good year is felt to be a good year in that part of your account. And a bad year, a year of loss, would mean a loss in that part of your account. So the investments are a bit riskier. And however, you're never only investing in the variable. You always do have at least 50% of your paycheck by paycheck investments going into the core. You can be part of the variable for as long as you'd like. If you decide to remove your money from the variable, Then you could submit a cancellation form to employee trust funds, and you could be out of the variable as soon as the following January. More information about the variable fund on ETF's website and links available through our website. If you find you're pleased with how SWIB is investing your money, you may make additional contributions into the Wisconsin retirement system if you'd like. You can set that up via direct bank transfer, or you could write a personal check and mail it to employee trust funds to deposit in your account, or you could set up regular payroll deductions to come out of your UW pay and have us electronically send it to employee trust funds. These additional contributions are after-tax contributions, unlike the 6.5% mandatory, which are pre-tax. And these additional contributions do not have an employer match. The 6.5% does, but these additional contributions do not. You are building a cash balance within your Wisconsin Retirement System account, so it would be important to complete and then give to employee trust funds your beneficiary designation form. There are two versions of the form. Some people prefer one to the other. You can review them both, choose the one you like best, complete it, and then send it over to employee trust funds so that they would know if you were to die before you retire, who owns the money that is in your WRS account. And more information about the Wisconsin retirement system is on their website. Again, various calculators, brochures, pamphlets, and videos. And my office here at the UW offers regular monthly retirement information sessions. We have one called Starting to Save, which is for employees who are at least 15 years, if not more, from retirement. We have a mid-career retirement check-in for those who are within 5 to 15 years of retirement. And we have a Ready to Retire session, which is for employees within 5 years of retirement. Each has a slightly different focus, but we provide information about the Wisconsin retirement system and the supplemental retirement plans, and each is free and available to you for registration if you'd like to join us. Now, there are two supplemental retirement plans in addition to the Wisconsin retirement system in which you can participate. The first is the UW's 403B, and it offers pre and post-tax, also called Roth, investment options. There is no employer match to these contributions sent to the UW's 403B. It would just be your own money going into the program and being invested. And you could contribute as much as $20,500 in this year of 2022 if you made enough money and decided to do so. But the money that you contribute to the UW's 403B would be invested and in a way dependent upon your choices with your investment group. We work both with Fidelity and TIAA. You choose one as your record keeper or participate with both. That would be up to you. And tell them from their investment options which of their choices you'd like to invest in. And then hopefully the money that you provide to them will show good investment, and $20 becomes $21, becomes $22, becomes $30, becomes eventually, by the time you're retired, $300, or whatever might actually happen to the investments. One can never be sure, but you hope that the amount that you give them today will end up being worth more when you do retire and you need to dip into the account and take money out for your expenses. The UW's 403B does have admin fees based on how much is in your account and which record keeper you chose, Fidelity or TIAA. And as part of the slides, if you ask for a copy of these slides, I do have information about those admin fees in the next kind of hidden slide. Now, there's also the state's 457B program, known as the Wisconsin Deferred Compensation Program. It is administered by the state of Wisconsin and through a company called Empower. It offers pre- and post-tax retirement investment options. Just like the 403B, there's no employer match, and you can contribute up to $20,500 this year if you, again, could afford to do so and wanted to do so from your paychecks. Admin fees for the state's 457B begin to be incurred once your account has at least $5,000 or more in it. And again, in the hidden slides that are part of this program, if you ask for copies, I have more information about those admin fees. You can choose to enroll in the UW's 403B or the state's 457B at any time during your employment. So this is a plan that's not subject to the 30-day deadline. You can choose to enroll right away, or you can wait a month or two or some years and enroll in the future. Once you've decided to enroll in the UW's 403B, you can sign up either through the completion of an easy enrollment form or by going online to the TIAA or Fidelity website, signing up with them, and then submitting to my office a salary reduction agreement so that we know you opened an account and you tell us how much you want us to start sending to them. If you sign up for the state's 457B, you do so either online or by calling them and sharing with them the plan enrollment code that's part of the program. Now, note that the program code, the plan enrollment code that's on the screen right now is really only good through the end of January 2022. Any time beyond that, when you're watching this video, you'll want to either review our website for the updated code or give my office, shoot us an email and ask us what it is. Now, next up, we are going to be talking about the health insurance offered to us through the state of Wisconsin. We have the information I'm discussing as well as more on our website. And I hadn't mentioned this earlier in the session, but this is a screenshot of our website. If you go to the hr.wisc.edu benefits site and you scroll down the page, you'll see this overview of all the different plans you have offered to you, and you can click on the different hyperlinks to learn more about each plan or to find the enrollment applications or change forms for each of the plans. So here, if you were on the website and learning more about health, you would either click on the State Group Health Insurance hyperlink itself or onto the Uniform Dental or Health Savings Account information, depending upon what it is you were looking for. How much it costs to enroll in the health insurance, which doctors you can visit, the services that you're allowed to actually seek care for, and how much you'll pay when you actually receive services from your doctors. All of that depends on which of the health plan options you elect. We're offered several by the state. There are kind of traditional deductible plans, what we would call a low deductible or regular deductible plan, called the IYC Health Plan, which is based in Wisconsin and offers in-network kind of Wisconsin providers and has coverage only if you stay within network. There's also the Access Plan, which has a nationwide network, and you're allowed to even step outside of that network if you'd like to and pay more for your services. But those are kind of traditional deductible copay plans. We also have the option between high deductible plans, again, a Wisconsin-based option and a nationwide option. And these particular plans with their high deductible also come with a health savings account. So if you're going to enroll in a high deductible option, you must also be ready to open an HSA. Regardless of which of the health plan designs you ultimately elect, each of them will offer you a with dental option. And with dental means in this case that you would attach a preventive, what they call uniform dental plan to your health insurance, which would provide you or your family routine dental cleanings and evaluations, x-rays, your children could have fluoride treatments. There could also be fillings and anesthesia for having those fillings and periodontal maintenance and even children's orthodontics as part of this program. So if elected, the health with dental, it would cost you an extra $3 a month if you had single health insurance or an extra $9 a month if you had family health insurance. I have some additional information about health later on during today's session, but the written information is available on our website and also directly on Delta Dental's website. You see the group number on the screen here, as well as the customer service phone number if you have specific questions about this uniform dental plan. What you will pay for your health insurance then depends in part on which of the health designs you're electing, whether it's the health plan or the access plan with its kind of traditional deductible copay designs, or the high deductible health plan, or the access high deductible health plan with their high deductible options and health savings accounts. It also depends on whether you're signing up for just yourself as an individual or if you want family coverage. and then whether or not you want to add that uniform dental onto your health insurance. So the with dental for an individual under the Wisconsin-based health plan would cost $99 a month. And you'll see that on the screen there. On the UW-Madison campus, many of our employees are enrolled in either the IYC health plan or its high deductible health plan version. If you end up yourself choosing one of these options, when you go in to make your choices, you will also specifically choose a network of doctors to be your doctors for the coming year. And you only visit those doctors unless it's an emergency and you need emergency room care somewhere. So here in Dane County, where Madison is located, many of the employees are enrolled in one of these designs with either Dean doctors or the GHC of South Central doctor groups or the Quartz UW doctor network. For the health plan and the high deductible health plan, you can learn more about which of the doctors' networks might be best for you by reviewing Employee Trust Fund's decision guide, which lists the various counties within Wisconsin and which of the networks of doctors have coverage in those counties. You can also do an electronic search on ETF's website in their health plan search webpage. And should you find yourself in need of medical care just outside of Wisconsin, perhaps you live on the border of Wisconsin and Minnesota or Iowa, Illinois, or in the UP, there may be a health plan or a high deductible health plan that has a network that still covers you even though you're not living in Wisconsin itself. So again, take a look at Employee Trust Fund's health plan search webpage to see which of the networks extend over the borders into other states and may still allow you to pay less to be part of the health plan or the high deductible health plan compared to the nationwide option and still provide you the coverage you need. If instead you're looking for a broader network of doctors that you can visit, a nationwide network in fact, you might choose between the Access plan or its high deductible version. And this Access coverage is more expensive, but it also offers then providers across the entire nation and even allows you to go outside of the network, even if it's not an emergency. Ultimately, how to find the best network for you will mean calling around, looking at websites, asking questions. So you might ask when you give a network a call about their current medical provider network, see whether your current doctor is in their network, or find out where their clinics are located and see if that's a convenient location for you to visit them from your home or from your work location. You might also ask them about their telemedicine services or which hospitals they'd send you to if you needed surgery. All of those could be information that you would gather and then it would help you make your decision. Once you do enroll in one of the health plan options and you visit one of your network providers, if you're seeking preventive services, they are covered 100% per federal law. Now, there are certain things that are considered preventive when seeking care, and you can see the lists of things that are considered preventive out on healthcare.gov. Just search using the word preventive, and information will pop up for you. If, however, you need care that's not considered preventive, then there will be a cost to you when you seek services through your provider network. And you'll owe either copays or deductibles, coinsurance, and there will be out-of-pocket limits or maximum out-of-pockets that you should know about. And that's what's coming up next. We'll start talking about kind of the traditional plans, the health plan and the access plan that offer a low deductible and a copay plan option. If you enroll in the health plan or the access plan and you're visiting your in-network providers, then you can expect an office visit copay whenever you go to visit a primary care provider or a specialist. Now, your primary care providers' office visits will cost you a $15 copay, or if you were to see a specialist or visit an urgent care center, then that would be a $25 copay. If you do need to visit the emergency room and they kind of treat you and fix you and send you home rather than admitting you to the hospital, then as part of that emergency room bill that you'll receive later, you'll also owe a $75 copay as part of that ER visit. Under these programs, if you need services that didn't fall within an office visit specifically, so you needed x-rays or diagnostic labs or had a surgical procedure, then you pay the full cost for those services at your in-network provider until you've met your annual deductible for the year. And the per person deductible under the health plan and the access plan is $250. So if you were to receive an x-ray, for example, and the x-ray and what the office costs for the radiologist to view the x-ray was a total of $1,000, you would be responsible for the first $250 of that $1,000 bill. If you do incur the expenses that mean you do need to meet your deductible for the year, then additional expenses after that for covered services will be split between you and the insurance company. This is called co-insurance. You are paying 10% of the rest of the cost of x-rays and diagnostic labs and surgical procedures, and the insurance company pays the rest, the other 90%. And so you would pay your 10% and the insurance company would pay their 90% until when you consider the 10% you were paying for covered medical services, as well as the office visit copays you've been paying, if they all add up to mean that you've spent $1,250 on your in-network covered services for the year, then you no longer need to pay for additional office visits or extra medical care. The insurance company will pay 100% of it. So you owe at most $1,250 per year for your covered medical care. Your prescription needs with pharmacy benefits are slightly separate than your medical care services. So while medical care is being treated by your insurance company, for example, perhaps you chose Gene or GHC or Quartz UW, your pharmacy benefits for prescriptions are handled by a company called Navitus. And to better understand what you might pay for prescriptions that are filled, you would visit Employee Trust Fund's website and view Navitus's formulary for the year. There's a section where you can open up information about all types of prescription drugs and then see what level of coverage Navitus is offering coverage for them. So different drugs will be placed in a different level by Navitus. Some will be marked as preventive, which means per federal rules, you pay nothing when you fill those drugs at the pharmacy. That might be contraceptives, for example. Other drugs will be listed as level 1, and you would pay $5 at the pharmacy when you fill them. Level 2 drugs would be up to $50 as your cost of the drug. Level 4s, skipping down to the bottom there, would be $50 when you filled them at the specialty pharmacy. And some individuals do fill level 3 drugs, and in those cases, they would pay 40% of the cost of the drug up to $150, and the difference in cost between that expensive level 3 drug and its less expensive alternate option. If you do find in the listing of Navitus, pharmacy benefits that you fill regularly a level 3 drug, you may want to give Navitus a call and have a talk with your doctor to see whether there's a less expensive option available to you. If you fill prescription drugs regularly, you may find that you hit the out-of-pocket limit for a drug for the year. And that means that you wouldn't pay more than, for example, $600 if you're filling level 1 and level 2 drugs repeatedly, or you wouldn't pay more than $8,750 per person if you're filling level 3 and level 4 drugs regularly. As part of your Navitus benefits, you could receive vaccines at various in-network pharmacies completely for free. And that could be useful compared to having a vaccine at a doctor's office if you're being charged an office visit copay. The pharmacy wouldn't charge that office visit copay, and so it could be completely free for you. So as an overview of the in-network coverage being offered by the IYC health plan design and the access plan design, when you're filling prescription drugs, they're through the company called Navitus, and you'll pay copays or a percentage of the cost of the drugs until potentially you've spent enough on a certain level of drug that you meet the out-of-pocket limit for that drug's tier for the rest of the year. If you're having visits with your doctor, office visit copays have either a $15 or a $25 office visit charge. If you're receiving services such as x-rays and diagnostic labs, surgical procedures, hospital stays, durable medical equipment, you owe the first $250 of those expenses every year towards your deductible. And if met, then you begin to pay just 10% of additional medical costs until potentially between the office visit copays, your deductible, and your coinsurance, if you spent $1,250 on your covered medical care for the year, then you're done, and the insurance company pays 100% for the rest of the medical covered care for the rest of the year. And I should say our year begins January 1st and ends December 31st if you're here for an entire calendar year, and it resets every January 1st. Now, if you are on the IYC health plan and you need services outside of your network, those out-of-network coverages are limited to just emergency and urgent care, and you will actually find network pharmacies across the entire nation. On this slide here, you see some examples of what often require emergency care. And you must use an in-network emergency room whenever possible, although it's understood that if you're away from your network emergency room and you have a heart attack or a stroke, you need to go to the nearest emergency room. The examples of urgent care items that are listed there note that you must use an in-network urgent care clinic if you're in your network service area. And if you're away from your network service area, you could, but in need of urgent care, you could give your insurance company a call. If you have the Access plan, your out-of-network medical coverage, you have options here. You are allowed to go out of network, even if it's not for an emergency. However, you will pay the first $500 of covered medical services you receive out of network. So that's kind of like the new deductible here, $500 per person. And then you begin to pay 30% of the cost of the remaining medical costs. The insurance company pays 70% until potentially you've met the out-of-pocket, the out-of-network, out-of-pocket limit of $2,000 per person. So while you are allowed to go and visit anyone for medical care out of network or not under the Access plan, it's less expensive if you're able to find an in-network provider. Now let's turn to the high deductible health plan and the Access high deductible health plan. These particular programs are different, although also somewhat similar to the two designs that we've just walked through. Under the high deductible health plan, you do choose a specific network of providers to be your doctors for the coming year, and you visit only those providers. You don't have coverage if you go out of network unless it was because you needed emergency care. Under the Access high deductible health plan, you do have that nationwide network upon which to draw, and you're still allowed to go out of network just because you want to. It doesn't have to be an emergency, but it will mean additional higher out-of-pocket costs. So we'll start with who is eligible for the high deductible health plan. Not every employee is. You might choose the high deductible health plan with its health savings account if you are a participant in the Wisconsin retirement system. And assuming you're not claimed as a dependent on someone else's taxes, filing with your spouse is fine, but you couldn't be claimed as a dependent by a parent, for example. And then you could enroll if you don't have other health insurance that's not itself a high deductible health plan. So if you are on any part of Medicare, TRICARE, or if your spouse or parent or partner covers you under their non-high deductible health plan or health FSA, you won't be eligible for the state's high deductible health plans. Also, if you're working under a J-1 visa, you should not choose the high deductible health plans because they don't meet your visa requirements. The idea behind the high deductible health plan options are that they will cost you less money per month from your paychecks compared to the more traditional plans. But if you need to seek services that aren't preventive, you will pay more out of pocket initially for those services before the insurance company kicks in. The perk behind high deductible health plans are that they are paired with a health savings account, also called an HSA. This is a bank account that you'd open and into which the UW would contribute money, $62.50 a month if you had the single high deductible health plan coverage, or $125 a month if you had the family coverage. The idea is that you could draw upon your HSA balance if you needed to pay out-of-pocket medical or prescription costs, but in the event that you can save more money in your HSA than you need to spend, hey, you have extra money in that account. And along the way, again, you're paying less money out of your paychecks. So the annual deductible for the high deductible and access high deductible health plans is $1,500 if you're on the single plan, or it's $3,000 if you have the family plan. This means that while your preventive services are still covered 100% per federal law, your non-preventive care, so if your arm needs an x-ray or you need a surgery, if you need to fill a prescription that isn't covered 100% as preventive, then you will pay the full negotiated cost for those drugs and services until you've met your deductible for the year, if in fact you do have so many prescriptions or services needed that you need to meet your deductible. And the thought is that you could use the money that you or the employer have been contributing into your HSA to pay for some or all of the expenses that you end up incurring during the year. Now, the UW, as your employer, will contribute $62.50 per month into your HSA if you have the single high deductible health plans, or $125 a month if you have family coverage under one of the high deductible health plans. And then you yourself may decide to contribute your own money up to the allowable federal limit, but that's optional. You don't have to contribute your own money if you don't want to. You can simply accept the employer contribution. And for those who are familiar with flexible spending accounts, but perhaps not with health savings accounts, I do have this compare and contrast chart indicating, giving you examples of how they sound similar, but they are in fact different types of accounts. And you could take a moment to review the similarities and differences between the HSAs compared to the FSAs. We will have more on flexible spending accounts coming up later in this session. So an overview of how the high deductible health plan and access high deductible health plans work. Your annual preventive care is covered 100%, but beyond that, if you need non-preventive prescriptions and office visits and medical care and equipment, you pay as the participant 100% of the negotiated cost of those expenses until you've met your annual deductible for the year, $1,500 if on the single plan or $3,000 if on the family plan. If you do meet the deductible for the year, then this high deductible plan transforms into more like a traditional plan where it has office visit copays and coinsurance. Potentially, if you have enough office visits and medical coinsurance needs, you might meet the out-of-pocket limit of the plans for the year, which means your share of the bills may have reached $2,500 if on the single plan, or $5,000 maximum if on the family plan. And after that, for the rest of the calendar year, the insurance company would pay 100% of your additional in-network prescriptions and medical costs. And all that while, you may be contributing to and taking money out of your pre-tax health savings account. If you were to enroll in the high deductible health plan and needed to seek coverage out of network, again, you'll find that it's limited to just emergency care and urgent care. If you enroll in the Access High Deductible Health Plan, you are allowed to go out of network, even for things that are not emergencies. However, your new high deductible is $2,000 if you're on the single plan, or $4,000 if on the family plan for these out-of-network services. And then you pay 30% of the additional costs until you've met an even higher out-of-pocket limit, $3,800 per person, not to exceed $7,600 per family. So for more details about the state's health insurance, information about the plans themselves, how to reach out to them and contact them, an overview of the doctors which each network works with, you can use Employee Trust Fund's website and search using the University of Wisconsin system as your employer, or go straight to the Wisconsin County search, or perhaps to the frequently asked questions section. There are many resources on ETF's site that will offer you an opportunity to learn about the state group health plan. And there are several things to consider before you decide which option is best for you. You'll want to consider whether or not the high deductible or the low deductible plans will be better, and whether or not you need that nationwide network, or whether choosing the smaller Wisconsin-based network will work for you. ETF offers a nice video that allows you to think about the plan designs and whether or not one would meet your needs better than another. And Employee Trust Fund's health plan search is where you'll actually be able to see information about each of the networks and learn more about their provider directories. Ultimately, you might decide you're not interested in enrolling in the state's health insurance, in which case you should explore whether or not you qualify for the opt-out incentive for the state group health. If you officially opt out of the state group health plan, you can receive payment, $83 each biweekly check, totaling as much as $2,000 over the course of a full year, as additional taxable income to you. This opt-out incentive is something you must elect. You don't receive it if you just kind of by default waive the enrollment. But assuming you actually take the action to elect the opt-out incentive and you continue to do so every year during the annual enrollment, you can be paid paycheck by paycheck for having officially opted out of the health plan. So if you're making your enrollments online, going into the state group health section, you'll note that by kind of opening up that section, the default of your enrollment will have been set to waive, but you don't want to leave it there if you plan to request the opt-out incentive money. The waive doesn't get you any opt-out money. You do actually have to select the opt-out incentive. So when it's time for you to enroll in or opt out or waive the health insurance, then you'll visit the benefit information tile, click on the Enroll Now button, and then choose from the different benefit options, open up the health section, and choose which health plan or opt out or waive that you decide to go with for the coming year. You'll see again initially that the default is set to waive. And so to enroll in one of the health options, you'll make a selection next to the name of the plan design that you want to elect. If you're choosing one of the Wisconsin-based plans, then you'd look for the name of the doctor network. And if you want it with the preventive dental, you have to look for that name and dental and select that particular option. Or if you're looking for the nationwide version, then you'd look for what they call the access in-state option, either plain or with the and dental attached to it if you want the preventive dental as part of your access plan. If you're an employee who has to submit paper applications, you'll find the health insurance application change form on our website, and it's also linked to on this slide. And you'll want to, of course, complete it and make sure that we receive it by your 30-day deadline. When your state group health insurance will begin, if you enroll in the coverage, depends in part on what classification of employee you are. So on the screen here, you see to the left, faculty, academic staff, and limited appointees, if they're enrolling timely in the health insurance, will have coverage as of the first day of the month on or following their first day of eligible employment. So if your first day had been, in this example, January 1st, and you enrolled and we received your choices by January 31st, then health would be retroeffective back to 1/1. If, however, someone had been hired January 22nd and submitted their application within their 30-day deadline, which in that example would have been February 21st, then their health insurance would be effective February 1st, the first of the month following their date of hire. Now, if you are not faculty, academic staff, nor a limited appointee, instead if you're university staff, you may have a choice of when your health insurance begins. So option 1 would be to enroll to have your state group health insurance begin the first of the month on or following your first day of eligible employment. And this would be an option if you don't already have 2 months of WRS state service, but you want the coverage to start immediately and you're willing to pay full cost for the first few months of health insurance premiums with no employer contribution from the UW. This option does require you to submit a paper application, even if you're eligible for online enrollment. The other option for university staff is to enroll in the health insurance, and again, do so either by paper application or online. And then your health insurance coverage will begin the first of the month after you've completed 2 months of state WRS service, which means if you don't have previous WRS service, you won't have health insurance for the first few months of your employment. The health insurance will only begin once the UW can begin contributing to your health premium. All right, so let's give a more specific example of what this might look like if you're university staff and you want to enroll in the health insurance. For our example here, we have a university staff hire with no previous state WRS service, and they were hired on January 22nd. Now they have two options for when their health insurance could start. And option one is that their coverage starts nearly immediately, the first of the month following their date of hire, which for them would mean February 1st. To take this option, they would submit a paper application, and on page 2 of that application, they would mark as soon as possible as far as when their coverage should begin. That would be the February 1st date. And then they would owe the full premium cost for their health insurance for the coverage months of February and of March. The full costs we have on an upcoming slide, but they're about $800 a month if you have single coverage, or nearer to $1,800 a month if you have family coverage. So that is one option for our university staff employee here. The other option is that they want perhaps to enroll in the health insurance and have it begin only when the UW will contribute their share of the cost, which means that they need to complete 2 months of WRS state service, and then the first of the next month, UW will begin to help them afford the health insurance. That would mean that their health insurance wouldn't be effective until April 1st. So if this were the choice of the employee, they could enroll online or by paper app. And if they completed a paper application, they would mark on page 2 not the ASAP option, but instead they'd mark when my employer contributes to my premium. And then they would not have employee health insurance for February nor for March. And it would be as of April 1st for April's coverage that the UW would begin to pay most of the health insurance premium, and the employee would begin to pay their smaller share. So the slides we had looked at earlier show the employee premiums when you're eligible for the UW to take care of most of the cost, and these are just what's left over for us as the employees to pay. And these amounts are the monthly premiums, so they would be divided in half. We'd pay the first half out of our A check and the second half out of our B check, month by month by month. The full cost of the state group health insurance is, again, more than the employee share generally. And here are some examples of the full premium costs. These are for the non-high deductible versions, and they show Dane County options, so the Access Plan with its nationwide coverage, but also Dean, GHC of South Central Wisconsin, and Quartz UW. If you were interested in looking for the full premium costs for other plans or for a high deductible version, then you could go to Employee Trust Fund's website and search for those total premiums. And then a note that some employees pay even a different amount for their health insurance. If you work less than half-time and you're a WRS employee, which means you work 49% or 19 hours a week or less, then you would split your health insurance premium 50-50 with the university. You'd pay half of it and the UW would pay half of it every month. That would also be true if you're a WRS employee and you work only one university staff temporary appointment. Again, that 50-50 split. So for you, if this is your category, you would want to better understand the total premium of the health insurance plan you might elect. And if you do enroll in the health insurance, you will receive 2, if not 3, ID cards in the mail. You'll receive an ID card from your chosen insurance network. You'd also receive an ID card from Navitus, the pharmacy benefits manager. And if you selected the health insurance with the dental option, you'd receive a third card from Delta Dental. Those member ID cards are mailed to you from the insurance companies themselves. So be sure that your home and mailing addresses that are listed in our personal information portal are accurate for you. Update them if you need to, because those are the addresses that we share with the different insurance companies. Next up, we have information about the state's disability plan, also called ICI, or Income Continuation Insurance. You'll find more detail than this brief overview can provide on our website under the Disability section, clicking on Income Continuation Insurance. If you are enrolled in the ICI Disability Insurance Program and you become disabled and cannot work and meet certain plan requirements, the ICI program can pay you up to 75% of your previous average monthly earnings. If you earn $64,000 a year or less, you may enroll in the ICI Standard Coverage Plan. If you earn more than $64,000 a year, you have the choice to elect both the standard coverage and, if you wish, the supplemental coverage as well. If enrolled in the ICI disability insurance and injured or ill and unable to work, you must first serve an elimination period, in other words, be disabled for a certain length of time, before the plan will begin to pay you any benefits. If you are a university staff employee, the plan may begin to pay you after 30 days, which is the elimination period of that plan, but not before all sick leave hours are used, up to 130 days. If you are faculty, academic staff, or a limited appointee, your elimination period is up to you, depending on what you choose when you enroll. It may be 30 days, or 90, 125, or 180 days, or until all sick leave hours are used, up to 130 days. What the ICI premium cost for you will be depends on what type of employment classification you hold, how much you earn per month, and in some cases, which elimination period you chose, or how many sick leave hours you have in savings. Please review the premium calculator on our website to learn more about what your ICI premium would be. If you enroll in the ICI program as a new employee and are university staff, the ICI benefits will be effective the first day of the month on or following your first day of eligible employment. If you're a faculty, academic staff, or limited appointee member, you have options for when your ICI program may begin. If you have no previous WRS state service, then your coverage could begin first of the month on or following your first day of eligible employment, but you will pay for the premium yourself for the first year until you've satisfied 12 months of WRS service. You may also, as a new employee, choose to enroll as faculty, academic staff, or a limited appointee in the ICI program, but have it start only after you've satisfied 12 months of WRS service. So one version allows you to enroll in what they call the early income continuation, and the other is the usual income continuation insurance. If you have a baby, the ICI disability insurance may provide a benefit to you as the birthing parent, but as with any disability claim, before the ICI benefits are paid, the claimant must meet both the elimination period of their program and they must exhaust their sick leave. It is possible, following the birth of your child, that the ICA benefit may not pay you. For example, if you have enough sick leave to remain in full pay status for the course of your disability, you wouldn't receive an ICI disability payment, nor might you if you were enrolled in an ICI plan with an elimination period that was longer than your actual disability. There are 3 enrollment opportunities, potentially, for the ICI disability insurance. Only one, however, is guaranteed to you as a new employee, and that is presumably this initial 30-day window that you're being offered as a new employee. If you want to enroll in the ICI plan, you may. If you choose not to enroll or you actively waive the coverage during this time period, you may be invited to join the ICI plan in the future through deferred enrollment, but that's only if you've saved a certain amount of sick leave then the plan may invite you to join. The other possible option as a way to enroll would be through evidence of insurability. This means that you fill out a paper application with medical information about yourself, and you list your doctor's information, and then you send that form to the insurance company. And the insurance company's underwriters review your information, they may reach out to your doctor, and then they decide whether or not they want to approve your application. So that is not a guaranteed method of enrollment. Neither can I guarantee that you'll be offered a deferred enrollment opportunity. So think carefully as a new employee about the ICI plan and whether you believe you would like to enroll or not. And now we move on to life insurance. There are 3 voluntary life insurance options available to you as a WRS employee. They're called the State Group Life Insurance Plan, the Individual and Family Group Life Insurance Plan, and the UW Employees Inc. Life Insurance Plan. Life insurance could be important to you because in the event that you pass away while covered by the plan, a life insurance policy would pay an amount of money to your chosen beneficiaries. You might consider electing an employee life insurance policy if you have people in your life who rely upon you to pay some or all of their bills, or simply to cover the cost of your funeral if you were to die. If you do enroll in one of the employee life insurance plans, be certain to submit a beneficiary designation form to the insurance company so that they would know who your beneficiaries are, who they would pay the money to if you were to pass away while an employee covered by this plan. Of the 3 optional life insurance plans being offered to you, you may enroll in none, 1, 2, or all 3. The State Group Life Insurance allows you to purchase units of life insurance coverage, where each unit is worth 1 times your annual salary. And you can purchase as few as 1 unit under State Group Life or as many as 5. For the individual and family life insurance, the benefit as a new employee doesn't allow, and as a new employee, you to elect more than $20,000, or you could elect as little as $5,000. But you can increase the value of your individual life insurance through that program annually during the fall enrollment period, until eventually you may have as much as $300,000 of coverage on your life. The UW Employees Inc. Life program pays a certain benefit based on how old you are at the time of death. The cost of the State Group Life Insurance depends on your age, how much coverage you've elected, and what your income level is. For the individual and family life insurance, the cost depends on your age and the amount of coverage you've elected. And for the UW Employees Inc. Life Plan, the cost to you depends on your age, year by year. With the State Group Life Insurance, you may purchase coverage for your family members if you've also purchased coverage on your own life. This is also true for the individual and family life insurance, but the UW Employees Inc. Life Insurance is only for you. It's not extendable to family. You have your initial 30-day enrollment period as a new employee to decide whether you want to elect State Group Life, Individual and Family Life, or the UW Employees Inc. Life. If you don't enroll timely, you waive by default. If you don't enroll timely and you want to enroll later, you can apply through evidence of insurability, sharing your medical information with the insurance company, and wait to see whether they grant you the enrollment or not. It is not guaranteed that they will accept your evidence of insurability application. If you do enroll timely in the life insurance, your coverage will begin the first of the month following 30 days from your eligible hire. So this is a different start date than your health insurance would begin. Also available to you as an employee is the UW's accidental death and dismemberment policy and the state's accident plan insurance. You'll find more detail about these plans on our website. You're welcome to enroll in either of the plans or just choose neither of them or enroll in both of them if you'd like. The accidental death and dismemberment policy offered by the UW is with a company called Zurich. This particular program has a charge to you based on the amount of benefit you've elected which could be as little as $25,000 or as much as $500,000. And the coverage cost depends on whether you're covering just yourself or you're also extending your coverage to your family. If you do elect the coverage to extend to your family, then the amount of payment that would be made to you if your family member were to have an accidental death or dismemberment event would be a percentage of the coverage you've elected for your own life. And for the state's accident plan, it's working with a company called Securian. The cost of the Securian accident plan depends on whether you're covering only yourself or you're also extending your coverage to family members. And under the Securian plan, if you have an accident, you need to remember to make a claim, and then the plan pays you cash, which differs in value depending upon the type of accident and injury that you incurred. Next up, we have the dental insurance. We've introduced some basic dental already when we discussed health insurance, when we were discussing the uniform dental benefits or the preventive care. And now we also can talk about the dental insurance as a supplemental standalone policy. The cost of the dental insurance, if elected, depends on which of the plans you've elected and then whom in your family you're covering. So you'll see on this chart here, the plans have different costs depending upon whether it's the preventive standalone plan, whether you want the major dental coverage of the Select or the Select Plus plans, and then again, whether you're covering just yourself or you're including family in the coverage. Under the dental insurance, if you were to elect the uniform dental or preventive dental plans, then you have a certain amount of coverage for cleanings and exams, emergency pain relief, and periodontal maintenance for the year. But under that initial column there, the uniform dental and preventive coverage, you do not have coverage for major dental work like crowns, bridges, implants, or oral surgery. Instead, if you're interested in that major dental work coverage, you could elect to enroll in the Select or the Select Plus plans. And they are different both in cost as well as which dentists you can visit. Under the Select plan, you can see that the in-network providers are limited to the Delta Dental PPO network, while under the Select Plus plan option, you could visit Delta Dental PPO and Delta Dental Premier providers. The deductibles are also different between those two plans, as are their annual benefit maximums. The Select plan will cover, after a $100 deductible, as much as $1,000 per person per year, while the Select Plus plan, after a $25 deductible, will cover a certain percentage of major services up to $2,500 per person per year. Also different between the Select and the Select Plus plan major dental options are that the Select plan offers no coverage for orthodontics, but the Select Plus plan does offer orthodontic coverage, and not just for children, as the uniform dental or preventive plans offer, but in fact the Select Plus plan could offer orthodontic coverage for you as an adult. It would pay 50% of an eligible orthodontic bill up to $1,500 per mouth per that mouth's lifetime. And next up, we'll talk about the vision insurance. The vision insurance is offered through Delta Vision, and you'll find its hyperlink on our website in the supplemental insurance section. What you would pay per month for the vision insurance depends on the amount of coverage you've elected. There is just one plan, so there's no choice to make. It's either yes, you want to enroll, or no, you don't, but you can decide who in your family you want to add for the coverage. If you do enroll in the vision insurance, visiting in-network providers means that you have a yearly routine exam copay of $15 per person. You can also purchase a basic pair of glasses for a copay of $25, or you could elect contact lenses. If you were to elect contact lenses instead of prescription spectacles, the contact lenses, you are allowed a $150 allowance per year. If you enroll in the Delta Vision plan, To receive the greatest amount of coverage possible through the insurance plan, visit their in-network iMed Insight Network eye doctors. And now we're moving on to the pre-tax flexible spending accounts. Information on these spending accounts are available on our website. The flexible spending accounts are offered through a company called Optum Financial and Connect Your Care. The idea behind flexible spending accounts is that you're allowed to set money aside from your paychecks without paying taxes on that money, and then you may spend that money on certain eligible expenses, having never paid taxes on those purchases. As an example, on the screen here, you see, assuming a 25% tax rate, someone with no FSA earning $200 and waiting for the money to come to them on their paycheck may have $50 withheld from their check before they actually receive then what is only $150 in their check. And they can then use that $150 to purchase anything. If they had elected the flexible spending account and had sent the $200 they'd earned into the flexible spending account, then no taxes were withheld from that $200. The money wasn't paid to them on their paycheck. Instead, that full $200 was sent to their flexible spending account, and it is now waiting for them to be spent on certain qualified expenses that they incur in 2022. Flexible spending accounts are meant to be spent on an annual basis. You are meant to spend all the money you send to your 2022 FSA by the end of the year, or you will forfeit some or all of your account balance. So again, the example shown here on the site or on the slide, if you had no FSA and earned $200, $50 may have been taken for tax, and you have $150 in cash to spend on anything, whether it's this year or to save it for a future year, while in this example, the dependent daycare FSA, if you'd earned $200 and sent that to the dependent daycare FSA, that money wasn't paid to you on your check. Instead, that $200 is waiting in your dependent daycare FSA to be spent on eligible dependent daycare expenses that your child has incurred before the end of the year. And if you weren't able to spend that money in time, the unspent amount is forfeited. So when we talk about qualifying expenses, we're talking about certain purchases you can make that the government doesn't require you to pay tax on. They would be certain office visit copays, prescription costs, vision expenses, or if we're talking about the dependent daycare FSA, certain nanny or daycare expenses. When we mention you must incur your expenses in 2022, to incur an expense means that you've actually received the service for that doctor's office visit, or your child was actually taken care of by the nanny or the daycare center within, in our example, 2022. And you'll see more information about qualifying expenses and deadlines to use your flexible spending accounts when you visit Optum Financial's website. There is the health or medical FSA that you may elect for as much as $2,750 and then use that money that you've sent from your paychecks into the FSA on qualifying expenses such as bandages, sunscreen, lab work, doctor's office visits, and other first aid needs. And there's the separate dependent daycare expense FSA that you might elect to up to $5,000 of your money going into the account that then can be spent on daycare expenses or before or after school care. Remember that if you do elect a flexible spending account for 2022, you are meant to spend the money that you contribute into the account by the end of the year. If you don't spend the money in your FSA, it is forfeited. If you enroll in the flexible spending accounts for 2022, your effective date for your FSA is the first of the month on or following your date of eligible hire, similar to what the health insurance start date would be. And the deductions, whatever you elected for the year, would be withheld from the remaining eligible paychecks from the year. If you're not here for a full year, that means that your election would be divided over fewer than 24 deductions because there are not a full 24 paychecks left in the year. You can review the 2022 pay calendar to count out how many more eligible paychecks you would receive in 2022 and consider what your election then would be divided by paycheck. If you do elect the health FSA, then your election is pre-funded, meaning if you signed up for $500 to go into the health FSA, $500 is available in the account as soon as the account is effective. And if you incur expenses at the pharmacy or your doctor's office, you could use your debit card to pay for those expenses directly from the account. It's a bit different with the dependent daycare account's balances. No money is in that account and available to you until the money has been withheld from your paychecks pre-tax and sent over to the account. There is no debit card associated with the dependent daycare expenses. You pay for your dependent's daycare expenses up front, and then you request reimbursement from the FSA. Be certain to save all expense documentation so that whether you've used the debit card for a health expense or you're submitting a claim for your dependent daycare expenses, you have proof the expenses were eligible and you can provide that information to Optum Financial when and if they ask for it. As part of signing up for the flexible spending accounts, you'll want to register online as a new user and consider downloading Optum's smartphone app. The deadlines to use a 2022 FSA mean that you must incur your claims on or after your FSA is effective, but not later than December 31st. Or if your employment ends before December 31st, you would have an earlier deadline. Talk to my office or your HR contact if your employment ends before the end of the year. Another pre-tax account are the parking and transit accounts. If you do incur expenses related to your work that involve parking for work or traveling for work, transit costs, you may have a certain amount of money withheld from your paychecks each month, sent over to the parking or transit accounts, and then use that money to reimburse yourself or pay for the parking or transit expenses you incur due to your work. However, if you are here at UW-Madison and you have a UW Transportation Services parking permit, it's possible you don't need to elect the parking account. An annual base lot permit, if paid through payroll deduction, is already pre-tax. However, if you pay for flex parking, meaning you just pay for parking only on the days when you use a lot, or you prepay for multi-day parking, and thus use your debit or credit card to have purchased the parking pass, it's possible the parking account could be useful. Again, this is an account that you could elect at any time of year, and then your coverage would be effective going forward after that election. To wrap up this session, I want to thank you for reviewing all of the slides with us today, and a reminder that if you incur a life event in your future, please reach out to my office or to your own HR office and let us know that you've incurred a marriage, adopted or birthed a child, are turning 26 and thus are losing your parents' insurance, etc., so that we can provide you with the appropriate information that will about how that life event will change or possibly affect your insurance options here at the UW. And with that, our session is brought to an end. Thank you for being with me today and reviewing these slides. Reach out to my office if you would like copies of these slides that include additional information, and have a very good day. Welcome to the UW-Madison.